Chylothorax is a rare but serious condition in pets, one that demands quick action, advanced diagnostics, and specialized treatment. At Safari Veterinary Care Centers, we are proud to offer expert care for pets facing this life-threatening challenge. Chylothorax occurs when a milky, fat-rich fluid called chyle leaks into the chest cavity. Normally, chyle travels harmlessly through a structure known as the thoracic duct, a vessel that carries lymphatic fluid from the abdomen to the blood vessels near the heart. This lymphatic system is crucial. It helps the body circulate fats absorbed from food, transports immune cells, and removes waste products from tissues. But when the thoracic duct becomes damaged, obstructed, or malformed, chyle has nowhere to go. Instead, it accumulates inside the chest cavity, squeezing the lungs and making it difficult, sometimes impossible, for the pet to breathe. One case at Safari highlights the dangers and hope surrounding chylothorax. Ben, a 6-year-old corgi, came to us struggling to breathe. Radiographs revealed that his lungs were collapsing under the pressure of fluid buildup. When we drained the fluid from his chest, it appeared milky white, a classic sign of chylothorax. Laboratory analysis confirmed it. The fluid contained a high number of lymphocytes and an extremely elevated triglyceride level, nearly 2,000 milligrams per deciliter, far above normal blood levels. This told us that Ben's thoracic duct was leaking chyle into his chest cavity. To manage the condition short-term, we placed a special chest tube with a subcutaneous port, allowing us to intermittently drain the fluid without repeated needle punctures. But draining alone is not a cure. The underlying problem, the damaged thoracic duct, had to be addressed. Our next step was advanced imaging. At Safari, we perform a specialized CT scan known as a lymphangiogram. In this procedure, a dye is injected into the lymphatic system through a small lymph node in the back leg. The dye travels through the lymph vessels and highlights the thoracic duct on the scan, allowing us to see exactly where the leak is occurring. Ben's CT scan showed us a complicated picture. His thoracic duct was twisted and branched, leaking chyle into the chest cavity instead of safely draining into the veins near his heart. Before surgery, we prepared carefully. We fed Ben heavy cream every hour for several hours. This rich food entered his lymphatic system, turning the usually invisible thoracic duct bright white, making it easier to see and safer to operate on during surgery. The surgery itself was delicate and highly technical. We made an incision between Ben's 8th and 9th ribs, carefully avoiding the heart and diaphragm. The thoracic duct lies perilously close to major blood vessels like the aorta and important nerves like the sympathetic chain, which controls automatic functions such as heart rate and breathing. Precision was critical. We located the damaged section of Ben's thoracic duct, placed surgical clips above and below the affected area, and removed the damaged segment. This prevents the duct from simply finding a new path and continuing to leak chyle. In Ben's case, we found more complications. The pericardial sac surrounding his heart had become inflamed and thickened due to the long-term presence of chyle. This thickened sac was restricting his heart's ability to pump effectively. So we also performed a pericardiectomy, removing the fibrotic pericardium to restore normal heart function. 1 week later, we tested the fluid from Ben's chest tube. The results were promising. No lymphocytes. No triglycerides. Instead, we found only healthy inflammatory cells, a normal sign of healing. We knew then that Ben's chylothorax had been cured. Soon after, Ben's chest port was removed, and he was breathing easily, eating normally, and regaining his playful spirit. Today, Ben is back to living life to the fullest, running, playing, and enjoying every breath without struggle. Chylothorax is a challenging condition, but at Safari Veterinary Care Centers, we combine expertise, technology, and compassion to give pets like Ben a second chance. Our advanced imaging, specialized surgical skills, and comprehensive post-operative care make us a leader in the management of chylothorax and other complex thoracic diseases. If your pet is experiencing unexplained difficulty breathing, coughing, or lethargy, don't wait. Chylothorax can be life-threatening, but early diagnosis and expert treatment can change everything. Trust your pet's health to the dedicated team at Safari. Visit safarivet.com today to learn more or schedule a consultation. At Safari Veterinary Care Centers, we believe every pet deserves a breath of hope and a lifetime of love.